Hi there, so this video is just to give you a short introduction to health and social care at the Sixth Form College Colchester, outline a little bit about the course and hopefully answer some questions about what we do in health and social care. So the first question is, what is health and social care? Now, health and social care covers loads of different issues, and the main sort of topics we would study would be looking at the values and skills that you need to include in care and providing care. So this might be how the medical professionals treat children and how they deal with conflict or issues when providing treatments. We also explore how individuals are supported to overcome a challenge. So this might be a patient with a mental health issue. What support is available to them? How do professionals, how do healthcare providers help them overcome barriers that might prevent them from accessing care? We might look at how professionals work together. So particularly thinking about how doctors or counsellors would work together, particularly if they're coming from different aspects. So doctors might cover medical and physical health issues, while counsellors might look at mental health, and how would they work together to provide the best treatment for a patient. And last but not least, we also look at stuff like how do we grow? So how does the human body grow and develop over time? So we might look at issues like diet and health. We might look at how lifestyle influences like drinking alcohol, smoking will have an impact on pregnancy or the body generally. So these are some of the areas that we would explore within health and social care. Now, the course is designed and aimed at a number of people. So anyone interested in a health and social care career. So this could be people going into nursing, midwifery, paramedics, counselling, speech therapy, being a social worker. It's also quite a broad subject. So we're not just going to cover health concerns, we are going to look at stuff like communication and self-development. So again, it would also branch out if you're looking at going into teaching or any role that would involve working with people and particularly communicating, interacting with people. If you're interested in health and social care, that's going to be a big plus, and particularly if you've studied the course before, you may have a little bit of an insight into how the course works, and that will only support you through this topic. If you haven't studied it before, don't panic, because we do take the approach quite slowly to help build up your understanding. And this is a coursework based subject, so we do 2 coursework projects across the 2 years. We also have 2 exam papers, but I will discuss those in a little bit. But essentially, if you are good at coursework, you enjoy coursework, this could be a course for you. The entry criteria for this course is a 4 in English. You do not need to have previously studied health and social care, but if you have got that will help, and that will form a basis. And also just be aware, this is a coursework based subject. So while we will be doing coursework, you need to be able to manage your time, your workload, and have good organisational skills. There's also an examining unit at the end of each year. So again, also be aware that there will be some exams, so revision and exam prep will also be key. From studying health and social care across the 2 years, you will actually gain 2 separate qualifications. So after completing the first year, you will gain a certificate in health and social care. After completing the second year, you will then gain the extended certificate in health and social care. Now, both these qualifications, or the extended certificate qualification, they are treated on par with an A-level qualification. So if you were to look at you applying to university or going through UCAS, you can use this health and social care course as part of your application, and there isn't any real restrictions or conditions of using it. Now, across the 2 years, you will be assessed, as I mentioned, in a number of ways. So in that first year, there will be 2 assessments, 2 parts that determine your grade. Now, the first of this is a coursework project that's worth 50% of the course. This unit is mainly looking at how we meet individual care needs. So it's based on that we will teach for a few lessons or for a couple of weeks and teach you a set of materials. We will then begin writing the coursework project. You'll be given draft guidance and deadlines, you'll be given assessment criteria to meet, and you'll be given support within lessons. So it's very much teaching, normal teaching lessons and materials, and then coursework writing for the second half of this proportion. The second half of the first year is then focused on exam, and you'll have an exam unit which takes an hour and a half, and you're presented a number of questions based on how the human body grows and develops. In year 2, a very similar pattern. The first part of the year is based on a coursework project, and that's focused on sociological perspectives. So we will teach you the sociological theory of healthcare, and you then have to write a coursework project about how this would reflect your local area. So it is a bit of research on your local area and where you live. The second half of the year 2, again, is another exam unit worth an hour and a half of writing time. Now, just to talk a little bit about this course at unit for the first year, just give you a little bit of an insight into that. The topic is about the principles, values and skills that are fundamental to meeting care and support needs of individuals. What this essentially comes down to is these kind of key areas here. So we might talk about the care values of care systems. We talk about communication and interaction skills. We talk about ethics in healthcare, personalising care, how to help people overcome a challenge, and how to work with other health professionals. Now, these are tailored to the coursework, tailored to the health and social care course, but there are elements of this which do have broader use. So particularly communication, interaction, working with other people, helping people overcome a challenge. These are skills that could be used in any other industry and type of employment. As part of human lifespan and development, we look at a number of topics, and these are some of the topics that will come up in our exam. And really, it's looking at how the body grows and changes from the point of birth to the point of death and all the stages we go through. Now, some of the topics we'll cover, one of these would be human development and how the human body develops over the life stages. So as you go through your life, your body changes in a number of ways, and they could be physical changes and about how your body grows and develops. They can be emotional, about how you understand your feelings, how you understand yourself, and how you form relationships and attachments with other people. Intellectually, you're always learning and your body grows, your intellectual skills develop. And last but not least, your social connections, your ties, your relationships, your friendships. And that's what we study in this first section, how the body changes over this time, what we call the development of our pies. Secondly, we look at factors affecting human development. So this is about how the human body is affected by other factors beyond the development of those key pies. So this can be how environmental issues like pollution has an impact on the human body. It could be genetic conditions. It can be influenced by income, wealth, our diet, our social factors. It could be our lifestyle choices like smoking and drinking. And we also look at issues like stress and how these all have an impact on the physical body and how that affects our health. And then last but not least, we look at aging. And this is about the impact of aging. And ultimately, it does overlap a little bit with the first and second topics. And it is really exploring what happens to us in later adulthood, particularly in old age. So as our body ages and how we get older, how does this affect our physical body? How is our mental health affected? And also about our social interactions. And all this forms part of the examined unit. So hopefully that has answered some questions for you. Now, if you have any more questions, if you have anything you'd like to ask, obviously feel free to contact the college. You've got the prospectus, which you can take a look at, and hopefully this has given you a little insight into what we do in health and social care. And we hope to see you soon. Thanks for watching.